Yeah, I guess it's my turn, and channeling my inner dinosaur. I remember back in the a while ago, uh, Zuboff studied basically the introduction of computers and what they did for organizations, and came up with this informate versus automate framework, which a generation of scholars found very, very useful. And I guess the augment or automate framework looks kind of very, very similar. For those of you who have short memories, it's great to reread that original work. Um, so we would like to see a lot of augmentation rather than automation, obviously, in the area of AI. And you can see a lot of possibilities in healthcare. For example, if you're a harried general practitioner who needs a quick diagnosis, having an algorithmic aid, AI-based, of course, only the latest and the coolest for our GPs, will feel much more confident about, kind of diagnosing something with the aid. Just plug in the symptoms, and you end up with a likelihood of this diagnosis, and so on. So you could have nurse practitioners do some of those same jobs. In an emergency department, you could have, for example, how many times have ED doctors or urgent care doctors waited for the reading of an image by the people who supposedly read these images and who are never there when you need them, right? So maybe if an AI can read the image and provide a preliminary diagnosis or tell you what it's not, then it's great. Then they can proceed and do something. And so it can be very, very helpful. And I'm talking very simple implementations here, kind of what we have been talking about. But I think Batya is absolutely right in a sense that it's all based on creating prediction based on very large data, right? It's all causal prediction, leading indicators, I think are the words you used, and it ends up being a likelihood prediction. So medicine is not about averages. Medicine is about the patient, right? You're informed by the averages, by the training you have gotten, but you cure the specific patient in front of you with a specific set of conditions that no one else kind of has. So that's what medicine is all about. And there will be a coming clash about this between automated kind of decision-making and what doctors are trained to do. So that's something people have not looked at very much, and I think will be coming up. We tend to fall back on frameworks that have proven useful in the past. For example, the professions framework, right? How do different occupations react to AI, or how, what's the differential, adoption or differential acceptance, or those kind of things. I was hoping we could do something different or a bit better. I think it's a great framework. It works. So that's why we use it. Professions is a very important divide. But nowadays, with the way work is reconfigured, these boundaries between professions are becoming more porous. So I'm not sure what should change, but maybe we can do something a bit better about the impact or the relations that get drawn or redrawn or changed and transformed by the introduction of AI that helps these relations. So these are the ideas I have, and I was hoping that to learn more from all of you.